All right. So I'm going to start off with my introduction, and we'll get going with the program, and hopefully some people will show up. But if not, they also know that I do recordings, so they will check it out after the fact. So I want to welcome everybody here to Peter White Public Library. My name is Marty Acketts, and I'm the Adult Programming Coordinator for the library. And it is my great pleasure this evening to introduce tonight's presenter for Women in Science, Dr. Jaime Crabb of Northern Michigan University's Nursing Department. And also she's the program coordinator for NMU's LPN program. So I come from a family of nurses. My aunt was a registered nurse. My sister was a registered nurse who was the director of an outpatient surgery center. My wife's sister and cousin are both alumni of NMU's LPN program. And I worked in the medical field for over 25 years, and some of my best friends are nurses. So to say that I have respect for the nursing profession is an understatement. And Jaime is an integral part in the education and training of new nurses at Northern Michigan University. Dr. Jaime Crabb has been in the nursing profession since 1996, starting as a candy striper at Bell Memorial Emergency Room as a senior in high school. She pursued her BSN from Northern Michigan University, achieving it in May of 2005, returning to school in 2011. She gained her Master of Science degree in nursing from Walden University. And then Jaime just most recently earned her doctorate of nursing practice from NMU in August of 2018, and currently serves as an associate professor for NMU. In doing a little research for tonight's program, I found that Jaime's doctoral thesis centered on how to provide nursing care for patients living in poverty. And she did this by assessing the attitudes of practical nursing students toward poverty and how these attitudes affected care provided toward this vulnerable population. And I read a portion of your thesis over the last couple of days, and it's a really fascinating project. But what I have learned through hosting these Women in Science events is that the best thing for me to do is to shut up and listen. Because the presenters I have the privilege of introducing are always smarter and more interesting than I am. So please help me in welcoming to Peter White Public Library, Dr. Jaime Crabb, and let's explore the nursing profession with her now.
Well, thank you very much, Marty. I'm very surprised that you read some of the doctoral thesis, but truly I appreciate that you did. There was a lot of work that was put into that. So just to begin with a little bit of background. So my name is Dr. Jaime Crabb. I am actually from Negaunee, born and raised, and I love the area, and I am so excited that I can give back to my community by working at Northern. I love the nursing profession. I think that it is an amazing profession with endless opportunities, and if you don't like something, you can go to a different position and having little to no issues getting another job. So I think that's really integral. As far as this, we are known as the most trusted profession with the exception of 9/11, and rightly so. We deal with a lot of stuff for our patients. Now, if you noticed in the introduction, so I was a candy striper when I was a senior in high school. So I had already started showing that interest in the medical profession. And I just happened to talk with an individual who was a phlebotomist at the hospital. And he had just such an interesting way of talking about blood drawing that initially I went and got a 2-year lab tech degree. So ironically, I've graduated from Northern 3 times. I am super proud to be a grad of Northern. And so let's get started and talk about this. So the first part that I want to talk about is there are so many opportunities. And so I pulled some pictures from online, but I just want to kind of talk about them just a little bit. So if you look in the upper corner, there is the nurse. She's in complete garb, so personal protective equipment. And she is dealing with a patient who probably has some form of respiratory something. And based on what has currently been going on, my guess would be COVID-19. Okay, so she's trying to protect herself while she is also taking care of that patient. The picture right down below it is in an emergency room, and it looks to me like they're working on a child. So that is kind of like our, God, we really don't want to see that happen. But if we look at reality, our kids do get sick and they need that nursing care. And they can have experiences at a young age. And if they have a bad experience at a young age, it can turn them off to seeking healthcare. And that is definitely what we do not want to do. The middle picture is actually a nurse who, and she's kind of holding her head, and she's actually a hospice nurse. And so, as we know with COVID-19, we've seen a lot of deaths in nursing, and the healthcare settings are overwhelmed. I believe just today, there was a release from the Marquette County Health Department that our numbers are high, and our facilities are near breaking points. The problem is, as a nurse, when you are in a regular time, as in not in a pandemic, you have a couple patients that pass away, but unless you're working a oncology floor or you're working specifically in hospice, you're not necessarily dealing with that passing as often. And it gives the nurse a chance to see somebody healthy and full of life that brings back that spark, that joy, that reminds them why they're doing what they're doing. Because in nursing, especially currently, you need to remember the why of why you went into nursing. That why has to be so ingrained in you that even when you have bad days, like the middle nurse, that you are able to recollect yourself, remember your why, pick yourself up, get up that next day, and go back into work and do it all over again. Now, the last picture there is a nurse working with an elderly patient. And it looks to me like there's actually some type of animal at that table. That was not my intention. It looks like a cat in a cage or something. But it could be like a memory care unit in which they have certain lifelike animals associated with that. But our elderly population, so we know that we have this huge population of baby boomers, and they are just starting to hit where they are needing care. We are going to see this population grow by leaps and bounds. So the current population that is considered elderly, specifically in name only, because I always say you're not old until you can't walk, you can't talk, and you can't do anything. Okay. But this particular population, we're going to see grow in leaps and bounds, and we have to be ready for that. So that means that those nurses that are willing to go into long-term care, we so need them. The advantage to long-term care is you know your residents and you are able to take care of them day in, day out. The unfortunate part is when you guys part is when they have passed. But that is truly a component of nursing. So if I go to this next slide, we've got a little one up in the corner. And actually, let me see if I can flick that down just so that you can see the other pictures. So we have the little one up in the corner because we deal with pediatrics. We hope to deal with healthy children and not so much seeing the ill children. But we are so thankful for places like St. Jude's, Headland DeVos downstate that are willing to be specialization are specialized in pediatrics and able to deal with those sick pediatric patients. Because what you have seen is there is actually a push to keep the pediatrics out of the hospital. We've found that it's actually better for them to be in their own environment, and they're less exposed to things if they're in their own environment. In the bottom corner, this is a flight nurse. So on staff at Northern, we actually have a flight nurse. She works for, it was Valley Med Flight. I believe they've had a name change since then. But they actually do flights across the UP into Wisconsin and other areas. So originally it used to be, if you got hurt in the Sioux, usually they would send you downstate because that would be the closest area. If you got hurt in Ironwood, you may go to Wausau or you may get sent to Marquette General. Well, that's like a 2 to 3 hour ride to get to us. Or think of the patient that's having the heart attack, and we know that time is tissue. We want to make sure that we are able to intervene there. And the best way to intervene is to get them to somewhere that has a coronary interventional area. So the only area in the UP that has that is Marquette General, or UP Health Systems Marquette. And then again, we have just a surgical nurse, and she is assessing her patient in the hospital, and you can see the pumps behind. So there are so many different options for our nurses. I brought in some of our labor and delivery. It takes a special person to be able to do labor and delivery. It is a wonderful, wonderful experience to be able to see those little ones and love on those little ones and hand them to mom and dad and see how happy they are to have brought them into the world. I, for one, am not super crazy about the labor process, but to each their own. Everyone likes different things. Down in the corner, you see it looks to be a gentleman, and he is getting assistance with his walker. So that ability to get that patient up for the first time after they've had a surgery and they've had difficulty getting up, and they get up that first time, and it's such a sense of accomplishment. It is one of those wonderful little things that feed that reason why you do what you do. And then of course, the other individual that you see here is, she's the warrior. She's obviously in a COVID unit. She's got the full gear on, N95. And she's somebody who chose to work in a COVID unit. And thank God for those people, because we certainly need them. Okay. So when we look at the Institute of Medicine, they have talked about how we need to do things better. And we know if we sit back and look, we like to be very reactive and maybe not so much proactive. So statements made by the Institute of Medicine, they did a research study with the Robert Wood Foundation in 2011. They published the Future of Nursing. So saying that nurses should practice to the full extent of their education and training. Well, Michigan is actually a state that is not full practice authority. Now, knowing that I have my nurse practitioner, but Michigan is one of 13 states that actually have not went through and processed anything in order to change that, with the exception of there were some changes during COVID, some changes to allow further practice. The next one is nurses should be able to achieve higher levels of education. And I have to tell you, to go back and get education. So when I went back from being a floor nurse to I went to Walden and I did an online master's. But when I did that, it was extremely difficult to manage working full time, having 3 kids, trying to do all the family things, and then trying to get an education. So we've made our education system somewhat complicated. And if you look in the Guinness Book of World Records, actually, the BSN is the most difficult degree to obtain. And I will tell you that our students hands down will agree with us. We definitely have rigor, but the reason we have rigor is because we don't want anything to happen to those patients that those students would be in charge of. So we want to know with a clear conscience when they go to pinning, which is our nursing rite of passage, when they go to pinning that night, we know without a doubt we have no worries about their clinical abilities. We're the gatekeepers in a sense, which is a really strenuous job. It can be very heart-wrenching at times. You can see potential in somebody, but they're just not able to meet the demands of the program. And so you have to say, you know, maybe this isn't the right time for you. It is a very, very difficult thing to say and a very, very difficult conversation to have. But if I had it and I was heartless, then I wouldn't be in the right profession. The nurses also should be full partners in everything. So one of the things that we're very, very big on is trying to promote interprofessional collaboration so that the doctor, the nurse, the physical therapist, the respiratory therapist, we're all hand in hand on the same team, on the same playing field, and we're all looking out and advocating for our patient because that is what we are supposed to do. If you're in it for a different reason, then you really got to evaluate that. But I mean, the sky is the limit with nursing. You can go anywhere, you can do anything. So I kind of went through and I was like, well, what was my reason to be a nurse? So the reason I went back, there were things that I saw that I felt, that could be done better. That could have been said better. We could have done that better. And so my goal was to make a difference. But if you're looking at reasons to become a nurse, you must care for others. You have to want to make a difference. That hand holding in the picture, I would always go in the room when I would see that a patient was passing because I didn't want them to pass by themselves. So I would go in there and I would hold their hand and I would tell them that it was okay. And it was one of the most wonderful things that I was able to provide for that patient. Even if they weren't my patient, it still allowed me to give back to them the only way that I knew that I could. Again, if you're seeing issues in care situations, you know, you have been in the hospital for a medical condition or a family member has, and you see things that just, you don't feel that they're happening the way they should. And we know our medical community is extremely strapped. I want to give back to my community. That is a huge reason and an amazing way to give back to your community by becoming a nurse and taking care of those community members. You want to help others. Oh my God, yes, please. Everyone who wants to help, that is awesome, right? That you can think above yourself and that you want to help others. You dislike seeing others suffer. You know, dying with dignity, allowing them to pass with a sense of dignity, that is huge. I don't want any of my patients to suffer. And if I am diligent and I am doing to the best of my ability and I am advocating for my patient, I can change that for them. So I also put on there some reasons not to be a nurse. So if you're in it for the money, that's not a good idea. And I have heard it a few times, and I really try to talk to those students and just say, hey, you know, is it really the money that brought you here? Yes, it is a decent paying job. I'm not going to lie there, but you need to be in it for the right reasons. It can't be a foothold, and you can't have a lack of patience. In nursing, Your patients, they have to be millions of miles long. You need to have patience, okay? Your patient depends on you. You are walking in that door and you are taking care of them sometimes at the worst time of their life. They've just been given a terminal diagnosis that they were told you only have X amount of time to live. They're upset, they're angry, and you have to let them run that and bounce that off you, because the advantage of them bouncing it off you is they're not bouncing it off their family, which allows them to start healing. They have to get that frustration out. So then I kind of looked at degrees in nursing. And Marty, you mentioned the LPN program coordinator, which unfortunately, due to financial constraints as one of the reasons, Northern is no longer offering their licensed practical nursing program. However, I do know that there is a program at Bay, and there is also a program at Gogebic Community College. So there are 2 LPN programs still within the UP. But LPNs are fantastic with skills, and they have a general information about all kinds of things. They may not be experts in certain areas, but they are able to help. Sometimes all you need is that extra set of hands, or maybe somebody that can pass that oral medication so that you can be in with the next patient who just came back from surgery. There are associate degree registered nurses. And the only thing I would say with that is that their curriculum doesn't focus as much on leadership and management, but usually they have great skills. When you look at a baccalaureate program, they do focus on that leadership and management component. And we also have the Institute of Medicine that was really pushing for the registered nurse to be a BSN at the bedside, because the research was stating that that was a better outcome for the patient. Personally, I think it kind of depends on your nurse, okay? Because I have seen some very solid associate degree registered nurses, and I would gladly have them at my bedside, just as well as I have seen BSN prepared. Now, there are other advanced degrees, so you can have a master's in science, and I kind of tried to pull the different areas where you could have a master's in science. So my particular master in science is in nursing education. Northern actually has a MSN program, which is a family nurse practitioner focus. There are also adult gerontology nurse practitioners. There is also psychiatric mental health, which we are dealing with a mental health crisis currently, and we don't have enough providers. So if ever you had any interest in mental health, doing a mental health nurse practitioner would be a great position. Nurse executives are another one, so they oftentimes work within the hospitals. Nursing informatics, if you are somebody who is computer savvy, technologically savvy, you love to be on your computer, you love to be creating things, nursing informatics may be an interesting field for you, and it is continuing to grow, especially with the use requirement, which focused on facilities moving towards the electronic health records so that there was an ability to access them from different areas. So I could be in Wyoming and they could still be able to get my medical records and be able to treat me appropriately, even though I'm from Michigan. Healthcare policy is huge, okay? Everything that we do is affected by policy, and I didn't totally understand that when I was at the bedside. However, since becoming a nurse practitioner, I had a fantastic preceptor. Her name was Mirth Condon, and she really drove home the point about how everything we do is affected by healthcare policy. And one thing that I became very aware of is it's interesting what things get thrown into a bill when they know they can get something passed. There's some extras that are added in that aren't necessarily a good thing. The other area is population health. So COVID-19 would be a great example of population health, right? We know that we're battling this condition. We're trying to look out for the good of the whole, global health. This is definitely an area. I do have my doctorate in nursing. My doctorate in nursing is a doctorate of nursing practice as a family nurse practitioner. So that is the terminal degree for nursing, a doctorate, so doctorate, PhD, they are equivalent for us. So there are different forms of doctorates. So there's an educational leadership track. So those people that are in education, but also focused on leadership. There is those that have a doctorate in nursing education, doctorate in philosophy. We have our doctorate of nursing science, and we do have a few DNSs. We have some CNSs as well, and those are masters out there yet. But that is unfortunately an area where we're seeing a decrease in. And then we have the doctorate of education as well. When we look at advanced practice nurses, so we have nurse practitioners that actually work in primary care or at the bedside, and they are taking care of patients. We have certified nurse midwives who actually go through and assist with the deliveries of babies. We have the clinical nurse specialist. Like I said, they're a small number. It was a very popular degree for a while, and then that has since changed. And then the ever popular CRNA, so the Certified Registered Nurse Anesthetist. So someone who is doing the anesthesia at the head of the bed when you are having surgery. When you think about it though, nurses have certainly come very far from Florence Nightingale dealing with the soldiers from the Crimean War by the lamplight, trying to improve the sanitation of their conditions. Now, when I started, we actually had some graduate nurses still on the floor practicing, or they were also known as the diploma nurse. And the diploma nurses, they actually did on-the-job training, and that is how they gained their certification as a nurse. We don't have, I don't believe, any more diploma options out there. So now it's an ADN or a BSN. But nursing has definitely evolved into something that can go anywhere and do anything. One of the biggest things that we're worried about as nurses is social determinants of health. And so I went through and just tried to pick a mnemonic that really kind of drove it home. So our physical address can actually affect our social determinants of health, which I don't think not everybody realizes that. Race and ethnicity and the socioeconomic status, those are the ones that I think people most often recognize. But your physical environment as well plays a factor into what you are dealing with. So what is the air quality? What is the water quality? Think of like Flint, who is dealing with the water crisis and have been for quite some time. We know that they have been having issues associated with that. The nutrition and exercise, the changes in public education to do away with some of the physical education requirements for our students. So what are our students good at? Our students are good at their phones, right? They can navigate technology. Well, nursing can use that too, to a point, but we have to make sure that we are making our kids well-rounded individuals that are able to handle things. And the instant gratification of the phone can cause a few issues there that, you know, from a medical perspective, to have that instant information is fantastic. But for our kids, they don't understand the patience that the rest of us had when we were growing up. No, you need to sit and wait, right? They have the instant gratification because of the phone. Just something to consider, because that's something that plays a factor into their education as they enter college. Transportation is a huge issue we know that not everybody can get to their medical appointments. And so when I was doing my nurse practitioner clinics at the site that I was at, there were certain patients that they may give an injection of an antibiotic because they know that the patient will not go get their antibiotics. So in order to treat them, they would do it differently based on whether the patient would come back to be treated or not. Access to utilities. We think sometimes that this is something so easy and not an issue. But I can't tell you the number of shutoff notices that happen, right? And there are resources out there, but if people don't know where their resources are, then they get stuck in this horrible cycle and they just keep going down and down and down and down. So we need to educate them so that we let them know what resources they have associated with those things. So these are just a few things. Healthcare provisions is a big one. There definitely is differences in what people are provided in healthcare, unfortunately. And that's something that we need to change. If I could change anything. Big shoes. But so I kind of highlighted the things that I think we need to change in healthcare and kind of some of the things that are out there to help change. So healthcare notoriously is very reactive. So, oh my God, we've got this new flu coming out, this H1N1, right? Oh, we have to make a vaccination for this H1N1. But in turn, what are we doing to be proactive about it? Okay, so those are the things that hit to the nutrition for the kids, the water, the utilities, the access to care, all of that stuff. So a couple of things that I wanted to highlight because of my experience in nursing, I actually am the local chapters called Xi Sigma, which is out of Northern Michigan University, the Sigma Theta Tau International Nursing Honor Society. I'm the local chapter Xi Sigma's president. And actually, Dr. Kristen Smith and I actually got to go to Indianapolis in November, and we presented on a research study that we were doing, trying to get students to walk into a room and be able to identify safety issues. And we presented it at that conference. So Sigma Theta Tau, the thing that I really am appreciative of that is that they have a global component as well. So it's not just United States based. They're actually looking at global health as well, which I think is huge. The next one that I have listed there is the Michigan Council of Nurse Practitioners, or MyCAMP, and I am currently the Region 1 representative. Region 1 is all of the UP, and I am our local chapter, which is the NAPN group, so our Northern Advanced Practice Nurse Network. I'm the treasurer for that. So I wear a lot of hats. I definitely do that. But we are working right now to work towards that full practice authority in the state of Michigan. And we actually have Senate Bill 680, which is in the Senate right now being discussed in hopes of forwarding that full practice authority and getting Michigan to be now more than what, let's see, we've got 37 states that are full practice authority, and Michigan isn't there yet. So, or yeah, 37. So let's get us there. The next one that I talk about is actually the International Nursing Association of Clinical Simulation and Learning. And this is based on simulation. So one of the hats that I wear at Northern is I am the simulation coordinator. And so I run simulation for the nursing students. I see a lot of value in the clinical simulation. And when I worked at the hospital, I actually created a couple of simulations for the faculty, or the not faculty, the nurses to actually go through. It just gives them a chance to experience something that they may not experience as they went through school. They may not experience in their first couple of years as a nurse. but to have the experience in a simulated environment is much safer than an actual patient being at risk. So definitely something that I think is very valuable. So what do we need in nursing? More talented, caring nurses, proactive nursing staffing. So when I say proactive staffing, we have such a shortage right now that some of our newer nurses, our inexperienced nurses, are getting put into positions of patients that are at a higher acuity than they should be taking on. And if we're going to do that, then we need to have somebody there to mentor, or somebody there who's a resource, who can actually resource them when they're there at the bedside. I once had a conversation with an LPN, and he was extremely knowledgeable. And he said to me, there is no reason for us to have national staffing ratios, but I disagree. I think that that's the only way that we're going to see some change in the local environment. Let's push for those national staffing ratios, so that nurse to patient ratio. Let's give the nurse the best chance, because if they have one bad experience, they may choose to leave the career path, and we need them. We know that. We talk about the need for nurses all the time. There's legislation currently trying to pass for community colleges to create the BSN nurse out of the community college. Currently, they only produce the ADNs. There's a lot of need for nurses, but there's also a lot of need to care for the nurses that we currently have. We know that they are burned out. We know that they have reached their zero. We need to build them back up. We also need nurses who advocate for their patients. And I can remember one time telling a doctor that he needed to come back and see the patient's family. The patient's family had just gotten there. They were very upset. They hadn't seen a doctor. They had questions. And the doctor was like, I need to leave. And I said, that's not the type of care we give here. I'll see you in 15 minutes. And yes, he did come. He was not happy initially, but he did say to me later, thank you for saying that, because you are right. Our families travel from all over, and then they travel on bad roads because you figure we have snow for 6 months of the year. But we have rural health up here. We're not big city health. We're rural health. And when bad things happen, we need the best people on board, and we can't afford to lose them. So we need to make sure that we're advocating for not only our patients, for our nurses as well. And we have to have nurses who are willing to nurture. The nurturing that has to occur is to build those new nurses up and make them competent nurses at the bedside. Not only do we want them competent when they leave nursing school, but the protocols for each hospital are slightly different. And so the students need somebody who's going to mentor them and really show them and help them critically think, so that they can be the best for their patient. Because ultimately, at the heart of everything we do is our patient. That's my story.
Awesome. Well, thank you. That was really wonderful. We'll see if anybody has any questions. Roberta, Mr. Roberta.
Yeah, I have a question.
Sure, go ahead.
Even before the pandemic, there was a shortage of nurses. And I can't remember where it was here in Southeast Michigan, where programs were cutting down the number of people that they were admitting. And that just floored me, because like I say, even then, pre-pandemic, there was a shortage. What can be done, to increase, the number of training facilities that can train those who are interested in nursing, increase the number of people that they accept. And I'm not saying to accept anyone, just anyone, because that's not going to work either. But for those who are interested, and then to be turned away because they're told, oh, we've lowered the number of people we're willing to admit this semester.
Well, so one of the biggest factors and issues that we've had, and I can speak to this because we're definitely seeing that, is we have difficulty with clinical placement. So in Marquette currently, UP Health Systems Marquette is where we send our students for the most part. We are sending them to UP Health Systems Bell for some rotations, but there are some offices that they may have taken students before and they're not willing to take them now. And the other thing is the fact that we've got the burnout going on, but that inability to get clinical placement, and we have clinical hour requirements by the State Board of Nursing. So we really need to look at that as a State Board of Nursing and see what constitutes clinical time. I think that there are some creative ways we could do it. I think we need to spend some time kind of maybe like a power powwow so that we're all at the table and throwing out ideas. I think right now everyone is kind of doing it in silos, and especially with the pandemic, because you figure every meeting that was usually being held in person, we're seeing switched to Zoom. And then, oh, it's just a Zoom meeting, I don't have to attend. And so you're missing that, you're not capturing that information. It's only one way, but I think we have some potential. Simulation is also another way that during the pandemic, initially, they actually changed it to say that the students could have 100% simulation. I would rather them not have 100% simulation because I really want them to get their fingers and their hands on a real patient, to actually have to talk to a real patient. I can simulate that. I can sit in the bed and I can, go through the steps, but for them to actually have to enter the room themselves and deal with a real patient is definitely a feat, and it's something that they should be doing before they graduate.
So let me ask this then. What would be the difference, like with doctors do their residencies, and, they, the head doctor will go on rounds and he or she will have a bunch of doctors who are doing their residency, and sometimes there'll be like 8 or 9 of them, going around and seeing patients and that sort of thing. So is a clinical placement for a nurse, is that like a residency, or is there a difference? In other words, is it possible for, once a nurse completes all of his or her, book work, that they could be, hired, but they have to shadow a nurse?
Well, I do know there are some online programs that actually do an intensive clinical, is what they call it. And the students pay a large sum of money and they go down for one weekend and they do their clinic. And it's a high stakes clinic. So if they make one mistake, they fail and then they have to come take it again. But their wait lists are so long because they don't have patients. There is a difference between what is done in MD school as opposed to nursing clinicals. However, you bring up a good point that maybe there's some potential. We offer a fall and winter offering for the students for nursing courses. We don't teach in the summer. And I think that if we taught in the summer, potentially we could definitely look at doing something like that. But our issue would be faculty right now. And with the current rate of the university and the fact that they were looking at, a decrease in enrollment, that's not something they would be willing to commit to at this time, which unfortunately it was predicted already anyway because of the number of kindergarten students, but then impacted even further by COVID-19.
Do you think that that because of COVID-19, I don't know if you can answer this or not, but do you think that COVID-19 is encouraging more people to want to become nurses, or is it making people think twice about entering the nursing profession and pursuing that?
I would say that it's a double-edged sword.
Mm-hmm.
So I would say, yes, it is definitely bringing in some people that normally would not have thought of nursing.
Mm-hmm.
But I also think it's driving some of our seasoned away.
Yeah.
And that seasoned nurse has so much knowledge.
Mm-hmm.
And we can teach till we're blue in the face, but they have the hands-on. I had this patient that did this. And we all have those stories,
Mm-hmm.
but they're still at the bedside.
Yeah. Yeah.
There's a lot of value to that.
Mm-hmm. Yeah. Wait, I had one other question. I wrote that here, and then what is the one why when you were like in the hospital doing nursing? What is the one why that on a tough day, you said you always have to remember why you became a nurse. What's that why that kept you going when you were having those difficult times?
My why was to make a difference for that
Mhm.
patient.
Yeah.
For example, I actually received an award from Life Point, Duke Life
Mm.
Point, when we first joined in the merger between Marquette General and Life Point.
Mm-hmm.
And actually this was written up by the chaplain at the time. So he came in to do last rites with the family for their loved one. And there I was at the head of the bed, and I was combing out the patient's hair. And he just thought that was so beautiful because the family was all around me and I was just back combing out hair. And then when he came and he did his service with them, I joined in with the service and I was part of that. And he just loved the interaction. And so he wrote that up. And ironically, I got an award for it.
Mm.
But it is what I did every day.
Mm-hmm.
When
Okay.
I, just after I got my nursing degree, I lost my grandpa. I was on midnight shift on orientation, and I was in a room with a very, very sick patient. And I can remember my cousin calling me and she was like, "Grandpa's gone." And I was like, "What do you mean Grandpa's gone?" She's like, "He died." And my grandpa was a very stoic, thin Swede, just very typical for this area.
Mm-hmm.
And he had a four-wheeler, and he was not interested in dumping a bunch of money into his four-wheeler, and he had like push started it down the hill. And as he push started it down the hill, he managed to, it was going so fast that it tipped, and one of his little homemade utensils cut him, and he ended up bleeding. And so he ended up passing away. But that night before I had went to work, I actually went and saw Grandpa. whereas my cousin didn't. And my cousin struggled with that guilt of not going to see grandpa. And having went and saw grandpa, I was able to say, this is not what he would have wanted. He passed the way he would have wanted. And for a new nurse, you know, and it was probably one of my first deaths that were close to me during that time. You know, it rocks your world. So being a nurse and being able to do that and being able to see past my own hurt that he is gone, but yet it was what he would have wanted.
Yeah.
Let's
see here. I've got one question here, and this says
Okay.
it's from Marty, but this is actually, I know Marty is Beth. So anyway, but she says that I was just wondering what you mean about our state not allowing full practice authority.
So in the state of Michigan, if you are a nurse practitioner, you have to work under a physician.
Oh,
You are not allowed to work independently. And there were changes to the rules during COVID that somewhat allowed the nurse practitioners to work independently. And, you know, I feel there's good physicians, there's bad physicians, there's good nurse practitioners, there's bad nurse practitioners. You're always going to get hit with that, right? But the nurse practitioners up until recently couldn't even write for diabetic shoes for a diabetic patient. Now, what's wrong with writing for diabetic shoes? How about physical therapy? What's wrong with writing for physical therapy? So there are some antiquated rules in the state of Michigan. We really do need to get full practice authority. We have an issue with access to care across the state of Michigan, and nurse practitioners can help us fill that.
Okay. I think that answers that question. Yep, that says thank you.
Definitely passionate about that. I'm sorry.
Well, Beth is my wife, and she's asking because our son sees a nurse practitioner, Annie Skewis, and
I love Annie.
we love Annie too, and she says, because during the last couple years, I think that she came in when Dr. Rao retired.
She did.
And yeah, and it seemed like she was practicing independently. I think they now have a pediatrician, MD, part of the practice, but was that
actually she's linked under the Bell Pediatrics right now.
Oh, okay.
Is what they're doing, so that there's always a physician over. But my kids also see Annie Skews. Love her.
Yeah.
I hands down would recommend her to anyone.
Yeah. Yeah.
She gives great care.
Yeah, she really does.
From a nursing perspective, and not to knock physicians, not at all, but my focus is not just the medical condition that the patient is experiencing. My focus is the entire patient.
Yeah.
And that is one difference from an MD to an NP. In all honesty, because having come from nursing, it's all about the patient, but the patient is not a medical condition.
Yeah. I think that's a really good ending note. I think that's a really good way to, really cap off what this is about. I mean, the importance of nursing and the difference between, a person who is treating a condition versus a person who is treating a person. Totally different. And, like I said, I come from a family of nurses, so I'm totally and completely respect all nurses. and so many of my friends are nurses, and that I have a couple who are in the DNP program right now. Eva
Yep,
and Amy Klein, I think.
yep.
So yeah, they're all just wonderful, wonderful people who I would trust anybody in my family to. So
Yep.
yeah. Well,
And
I
that's a
want to,
good feeling.
it really, and you can pass that along to anybody that's in your program. I mean, yeah, I would totally trust any person that I know that's coming out of the DNP program for anything. So yeah.
That's awesome.
Yeah. All right. Well, thank you, Jamie. This has been really wonderful. And we're gonna be doing another Women in Science next month with oh gosh, I can't remember her name. She's from the sociology department at Northern. Renson Yang, I think is her name.
Okay.
So she's gonna be next month's speaker. But you know what, Jamie, this was so wonderful. I hope that maybe in the future you'll come back and give another presentation on some other topic as well.
You let me know what you want, Marty. I'll do it.
Awesome. Thank you, Jamie. All right.
Absolutely.
All right. Awesome. Well, you have a great night, everybody. Stay healthy, and hope you have a wonderful weekend. And Jamie, I hope you get some rest this weekend.
Yes, I will.
All right. We'll see you later.
Okay, thank you.
Thank you. Bye-bye. Bye, Mr. Roberta.
Uh,